So today is my chemo day. I see a doctor first, and then I go to chemo. Scared. Don't know the outcome. You know, some people lose their teeth doing chemo. Definitely, depending on the chemo that you take, you can lose your hair. The one that I'm taking, I will lose my hair. So that's why you see the video that I posted about me shaving my head. You know, I really don't know how to feel besides sadness and scared and, you know, but I just have to keep pushing forward, and that's what I'm trying to do. Do you want to say something, honey?
I'd say we face the fear head on, and go into this with that gut feeling of fear, but optimism and positivity. So no matter the outcome, we know that we were positive and we triumphed no matter what. And you'll always be amazing and beautiful to the people that matter to you, no matter what. So including the people who you're sharing the story with, you'll always be amazing to them as well too.
Yeah. But I will be giving you guys updates. This is a pretty short video, but I'm gonna add other clips to it. I thank you guys for always supporting me and for your kind words and just helping me push forward. So until the next clip. So I'm sitting here waiting. I'm like, you know what? You took out my whole uterus. I got a full hysterectomy, but I'm still getting pimples. And like, my face is still breaking out. But right now I'm sitting, waiting to get the chemo done. I have to be here for about 5 hours. Got my bracelet, and just, you know, I'm okay. I keep going like this because it feels so weird. Like, and then when you shave, you can feel all the coldness in your head. But everybody loves how it looks. I accidentally, you remember guys, when I showed you the video, I accidentally had shaved like this. So I made Odessa fix it, and then we shaved here and here so it could kind of match, like kind of like a mohawk. But everybody loves it. And, you know, I don't really feel bad that I shaved my hair. I kind of feel good. You can see my grays. But I'm just going to have to keep up with it so that way, you know, it doesn't... Because my hair grows pretty fast. But here, just waiting. Odessa bought me some food. Hopefully I can eat it and not feel sick. So, got a brown bag right there. Has my chemo in it. I was a little tired. They gave me a couple of anti-nausea medications, and Benadryl was one of them, but it made me really tired. So I go to the IV, and they're doing it like small doses. Like, they increase the dose every time, making sure I don't react weirdly to it. So that's what they're doing. So far it's okay, but usually you don't feel nothing till days after. I feel tired. That's about it. Good morning, guys. It is Saturday, January 8th, and I didn't finish talking about what happened yesterday. It was my first chemo treatment. Right now I haven't felt really anything except nausea somewhat, but usually like effects don't start to kick in till days after. The only thing, like, they had trouble finding my veins because they don't look for these veins. Like, they look for veins. I got a bruise right there because after the first chemo bag, the little tube in the inside turned, and so it started to get swollen. So now you can see the bruise. And so they had to pull it out and then do like one right here. You see that little spot right there? They had to put in a thing in there because this one had got damaged. So I have to drink more water, be more hydrated so that my veins are hydrated and they're more visible. But they gave me several anti-nausea medications, and when they gave me Benadryl, I was tired, and whatever else they gave me, like I just started feeling weird, and I fell asleep for a while the chemo was going through me. You don't get any side effects right away with the chemo, like when it's going into your body. You don't start to feel anything. But it was, the first time, and it was really scary. And I spoke to like nurses, and I spoke to a patient that was across from me that finished her chemo the day before, but she was getting like hormone treatment because she had breast cancer. And she found out she had breast cancer because her whole boob got in a rash and it was red. And she was like, this is not normal. So anyway, but going back, I like, it wasn't what I expected, like, because you think like, oh my God, what's gonna happen? But for the days to come, I will be documenting like what I feel, what's going on with my body or whatever. And usually like with chemo, if anybody doesn't know, when you do chemotherapy, it kills the bad cells, but it also kills the good cells. So your body becomes vulnerable to any infection, anything. Like, it becomes vulnerable to the other diseases. So your immune system drops, like it does a drop, and then it goes back up. So that's why like they giving me 5-hour chemo days, 5-hour chemo days. Like I do it every 3 weeks, but I stay there for 5 hours to do 2 different types of chemos that they give me. Let me look for the drugs. I don't want to be telling you, oh, they're giving me this type of they're giving me chemo, but I'm not telling you the type that's being given to me. My doctor, when I saw her, she was like, oh, you shaved your head already? I said, yeah, why would I put myself through the trauma of holding my hair and then it starts, even the nurses was like, by the second week, your hair starts falling. So they gave me this one, and this one. So those are the 2 chemos that they're giving me. It says the possible side effects. These are a number of things that you can do to manage the side effects of carboplatin. I don't know how to say it. Talk to your care team about these recommendations. They can help. Low white blood cell count. So leukemia, and I don't know what that. White blood cells are important for fighting infection. While recovering treatment, your white blood count can drop, putting you at a higher risk for getting an infection. You should let your doctor, nurse know right away if you have a fever, temperature greater than 100.4, sore throat or cold, shortness of breath, cough, burning or urination, burning with urination, or a sore that doesn't heal. Tips to preventing infection. Well, I'm not going to read all that, but those are the 2 types of chemos that I'm taking. With these chemos, you can become constipated or you can have diarrhea. You can have vomiting. The doctors told me if you get vomiting that is too much, you have to call, because they have to be able to control what's going on. If you have too much diarrhea, they have to be able to control that as well. They have to be able to give you medications to help you stop that, because they don't need you dehydrated and they don't need you to get sicker while on chemo. So, you know, they have come a long way with anti-nausea medication and the way they give the treatment. So, some people get a port and some people don't. So the reason I didn't get a port is because I'm not having reoccurring treatments. And my veins are not really bad. Like my veins, like I'm young. So, you know, this treatment is to prevent me from getting to kill, or if there is any cancer cells, to kill them. They didn't find anything when they did the biopsy, but they're just being like, it's a preventative method. So usually ports are for older or people who have reoccurring treatment, for people who have been on chemo very long, and that's what was explained to me. So for right now, you know, I'm okay. I don't know what the days to come are gonna look like. Sorry, my kids in the background, they're just not listening. But usually people say it gets better the second treatment or the third treatment, it gets better. So I have to have 6 treatments. You know, I'm just hoping, and I know God is with me, and I know he's making sure that everything's okay. And, you know, so far everything's been good. I had to take 3 COVID tests. 2 for each surgery, and then to go into chemo I had to take a COVID test, and every time I go to do chemo I have to take another COVID test. So, you know, it's just preventative services, because if you're sick you can't do chemo. They have to stop the chemo, wait till you get better, and then start the chemo again. So, you know, God's been covering me this whole time, and he's been making sure that I'm okay, that I'm healthy, and allowing me to heal as quick. And I thank everybody that prays for me, that genuinely loves and cares for me, and that is always contacting me and letting me know that they care about me. So thank you guys for watching, and I hope you enjoyed this video. Okay, so I did forget to mention, because I was thinking it was 2 chemos. One is a steroid and one is chemo. So I forgot what the steroid was for. I'll probably ask again, and then I'll be able to tell you guys in another video. So I just wanted to let you guys know that one is a steroid and one is chemo.